The Democratic Republic of Congo is a country located in the western coast of Central Africa. Congo faces many challenges concerning health due to factors common in developing countries, including poverty, poor sanitation, and a large population. Disease outbreak is something the country has struggled greatly with for many years, with some epidemics becoming so widespread they make news tabloids all around the world. We are the DRC Disease Outbreak Prevention Team, and our mission is to reduce cases of disease outbreak and implement better protection strategies in Congo. Our vision is to implement better containment strategies and greatly reduce the number of disease outbreaks that Congo faces through making vaccinations and access to medical facilities readily available to the public. We plan to tackle the challenges disease outbreaks pose through methods such as vaccine campaigns, construction of new health centers, and educating the public. We believe that with the implementation of our plan, we will be able to greatly improve the lives of the citizens.
Our third objective is to spread awareness of possible diseases and strategies to prevent them. We plan to use education in two ways. One is to educate potential doctors and nurses, and the other is to educate the general population. We want to educate potential doctors as there is a shortage of medical professionals in the country. According to the CIA's World Factbook, the DRC has just 9 physicians per 100,000 people. Also, out of these 9 medical professionals, fewer than 2 specialize in treating disease. In regards to educating the rest of the population, we plan to spread information about prevention and treatment strategies. Data from the World Health Organization shows that HIV, tuberculosis, malaria, and measles rates are significantly higher in the DRC than they are in the rest of the world. With proper knowledge and awareness about these diseases, the spread of these diseases will be significantly reduced. One anticipated risk of this is actually getting the information out to all the people. The DRC has a population of 81.3 million people, and there's no centralized way to get this information out to all of them. It is also difficult to get this information out to all the children, as there is only about 50% of the population with any secondary education. Our approach to mitigate this risk is to hold information sessions in the villages as well as the cities in order to get the information to all parts of the country. We can measure the success of this by tracking the number of disease cases and the number of successful treatments in the upcoming years.
The second measure we will take is improving the quality of health clinics and making them more accessible to the public by building more in rural areas, ensuring they are adequately staffed with health professionals, and implementing a better transportation system to them. Due to DR Congo being one of the poorest countries in the world and the weak government system resulting from years of civil war, the nation lacks an efficient healthcare system. The current healthcare system does not meet the needs of the population. Health facilities are not accessible to the entirety of the population, the quality of service has continuously deteriorated, and the facilities that do exist in the country's 26 provinces are typically strained to their limits. With a country so prone to dangerous disease outbreaks, it is essential to solve this problem in order to stop these panic-inducing epidemics. To help fix this issue, we will first build more secondary care facilities, such as hospitals, clinics, and health centers in rural areas of the country where poor roads and transportation systems prevent the sick from receiving professional care. In addition to building more facilities, we will also implement ambulances in each of the hospitals, as DR Congo currently does not offer an ambulance service to the public, and begin construction to improve the poor condition of the roads in the country. With 70% of reported deaths occurring before the patient reaches the hospital, this will save lives as transportation will be more readily available and efficient. A challenge with building more hospitals is finding qualified staff to work in them. In order to prevent this from becoming an issue, we will start a program here in the United States that will give medical professionals the opportunity to work overseas to train residents in the DR Congo to treat and handle disease and sickness. The indicator of success we will use is the reduction of the percentage of patient deaths that occur on the way to health facilities.
Our first solution will be making sure a majority of the population is vaccinated. Therefore, we will offer free vaccinations at health clinics throughout the country. With the majority of the population being vaccinated, disease won't be able to spread as easily, and citizens will be protected from outbreaks before they happen. Pawanacharya conducted a study on vaccinations in Africa, concluding individual-level characteristics, particularly health service utilization, such as 4 ANC visits, institutional delivery, and postnatal visits, had a strong positive effect on full immunization coverage. One potential risk is that this solution can easily become null and void because it is dependent upon each individual taking advantage of the vaccines we provide. To help mitigate this problem, we will also launch a campaign to ensure that individuals receive vaccinations. We will also send individuals to promote immunization and inform people of the benefits of vaccination. To ensure that our efforts have been effective in the community, we will use both the male and female adult mortality rate, which according to the HDR is currently 280 per 1,000 for males and 232 per 1,000 for females, compared to US, which is 134 and 80 respectively. Therefore, over the next 5 years, our goal is to get the adult mortality rate to below 200 for men and 175 for women.
In the next 5 years, our organization is committed to the completion and implementation of these objectives. During the first 3 years, we will focus on the construction of secondary care facilities while holding informational sessions in villages and cities to educate the public on preventable diseases. Vaccinations will be provided across the country at no cost. By the end of the 3rd year, we hope to have the majority of the population vaccinated. The main focus of the 4th year will be the training of local healthcare professionals. We will bring physicians from the United States to conduct training seminars. With the implementation of these objectives, we hope to reduce the number of disease outbreaks in the DR Congo.